Now, we learnt in our MBBS days that everything we used to answer traumatic, inflammatory, neoplastic, and we will follow the same protocol to evaluate these salivary gland lesions. One more to add it is calculus disease or sialolithiasis is very, very common. So, this was a female who walked in with a history of pain, swelling in the left submandibular gland. Now, see this submandibular gland. What catches your attention at first go is dilated ducts. So whenever you see this dilated ducts within submandibular gland, your mind should run that, let me search what is obstructing these ducts. And see this, as sir had also shown in his case, how beautifully we can see a calculus sitting obstructing the duct. You don't have to think much because it's a hyperreflective focus with posterior acoustic shadowing. We know that this is nothing but a calculus. So see this case, this patient had recurrent times she was removed the calculus, but she again kept on getting these submandibular duct calculi, and see how beautifully you can demonstrate the same on ultrasound. As against in parotid, the calculi are less common, but see this case, parotid gland, again dilated ducts, and if you search very, very carefully, a large calculus sitting there in the Stensen's duct, and this is causing the obstruction and dilatation of the ducts. So, calculus, I think you are very good at picking up on ultrasound, but always these dilated ducts, when you see within the gland, always turn around your probe, search how the ducts are leading, and most of the time in day-to-day practice, you will see calculus disease. So this is all about sialolithiasis. Always remember, calculi are more common in submandibular gland as against parotid because of the greater mucus content there. And today with ultrasound, we are almost very, very good at picking up these calculi. Coming to inflammatory conditions. So pediatric age group, sometimes they come with these swellings in the parotid gland. Patient just has fullness and comes to you with imaging. So see what you are seeing within the parotid gland. You are seeing multiple rounded hypoechoic lesions with normal background gland and some degree of vascularity. This you should remember is nothing but benign lymphoid hyperplasia. In fact, many a times in these patients, patient doesn't have much symptoms. There are level 2 jugulodigastric node, and this in a pediatric age group is nothing but benign lymphoid hyperplasia. See the normal submandibular glands which are seen here. As against, when you see a patient with pain, fever, swelling in the glands, and an angry looking gland like this with increased vascularity on Doppler, multiple rounded hypoechoic lesions within it, some reactive level 2 lymph nodes at the jugulodigastric, the normal looking submandibular gland, the parotid there is normal, but you're looking at an angry looking gland with increased echogenicity, you know you're dealing with nothing but sialadenitis. So it's going to most commonly involve the parotid gland and less commonly the submandibular. Most commonest causes could be stones, stricture, but what's very important as you as a sonologist is to pick up the complications once you have picked up a sialadenitis and follow up each and every case of sialadenitis, because many times there can be complications in terms of this forming an abscess or the nodes which are enlarged because of the inflammation undergo suppuration. So let's see two cases related to that also. In pediatric age group, mumps today is less seen, but yes, viral infections like mump can typically present as bilateral large parotid masses, and cervical adenopathy can be there along with it, and this kind of enlarged glands with rounded hypoechoic appearance, patient having bilateral presentation, pediatric age group, you know you are dealing with something like mumps. But see this case, patient was diagnosed case of acute sialadenitis, but subsequently replacing this enlarged gland was this hypoechoic area with liquefaction seen within it. You see moving echoes within it, and when you see something like that, you know that this sialadenitis has undergone complication in terms of secondary abscess formation. So see this normal left parotid gland, but see this parotid with large abscess which has formed secondary to severe sialadenitis. Then, as I was telling you, in pediatric age group, many of these nodes which get enlarged because of sialadenitis undergo secondary suppuration. So see, in this case, the nodes have become hypoechoic, necrotic, undergone secondary liquefaction, and these are the complications which you need to alert the clinician that whether there is an abscess, whether the nodes have undergone suppuration, because the treatment part changes accordingly. Sometimes the gland, the Sialadenitis can inflame and present and involve all the glands. So see this case, reactive lymph nodes, the parotid glands were enlarged, the submandibular glands were enlarged. Putting a power Doppler, we can see that there was so much vascularity in and enlarged bilateral glands with some cellulitis developed within, and this is nothing but pan-Sialadenitis. So all the glands are getting involved, patient presenting with pain, fever, you can clinch a diagnosis of pan-Sialadenitis. From acute, we move on to chronic. Do chronic inflammatory conditions involve parotids? So you need to remember this female patient walking in your clinical suit with dry eyes, dry mouth. So you're going to always have an history to support the diagnosis. Whenever you're going to see that Sjogren's can involve the parotid gland, and they also present with multiple rounded hypoechoic lesions within the parotid gland, but the background gland here will always be heterogeneous. Again, a very important thing is long-standing Sjogren's can lead to gland undergoing atrophy. So it all depends when the patient presents to you and you image it. One of the more important role of ultrasound in Sjogren's is one, to rule out salivary gland involvement, but most importantly, lymphomas are associated in Sjogren's within the parotid, and hence the imaging is important. So see, this imaging was just like the jugular lymphoid hyperplasia, but the background gland is completely heterogeneous. So multiple rounded hypoechoic areas, female patient, dry eyes, dry mouth, this kind of pattern, you're going to start thinking in terms of Sjogren's.